Hello, and welcome to some more questions from Nobody Wants You Healthy. So Steve, what's our first question today?
Well, this comes from the website, and Alicia, she's a 55-year-old woman, having read your book and some of the excerpts and questions on the site, she thought she might benefit from a testosterone therapy because she was feeling fatigued and so on. Her doctor tested her, and in fact, it came out low, her testosterone, and some other levels, but he said, you're fine, that's fine. And so she'd also heard that, the traditional or the levels this day are a lot different than they were, back in the 1970s. So she's worried that fine may not be optimal. And so she did find a provider with testosterone pellet implants who's willing to do it. But now she's a little reluctant. Should I tell my doctor that even though he said it's fine, found somebody that said, no, you can do better, is going to give me the therapy? Is there any value in her discussing her decision with her doctor?
Alicia, good question. Thank you for reading my book. And for those of you out there who are interested, you can go to nobodywantsyouhealthy.com to find out more about the book. Alicia, you got some salient facts there. You're right. The levels of the lab are not your optimal levels or good levels. The levels reported for female testosterone in the lab are the average of a very sick population, since we're 60% lower or more than we were in 1970, and 2 standard deviations on either side of that. So if you've determined your level is low with the pellet provider you spoke with, then I'm pretty convinced that it's low. As far as telling your doctor, I think that it's important for patients to communicate with their doctor. It's not that testosterone will have bad interactions with any of your medications. It's just that if they can see their patients improving, see the course of testosterone pellet therapy, they might actually learn from you and offer it to more of their patients and actually prevent illness, improve health, create a happier patient population, and everybody comes out a winner that way. So I would recommend, yes, you do speak with your doctor about it. If your doctor becomes enraged, then obviously it's time to switch doctors. But if your doctor listens and observes you and sees how you're doing over the next year on testosterone pellet therapy, I think that would be a good thing.